getting NHS help when you need it during coronavirus outbreak. In this guide, personal protective equipment, going to accident and emergency, hospital appointments, getting help from your GP, getting medicine, and getting help from the dentist. In this guide continued, getting help with your eye care, looking after your feelings, specialist learning disability and autism and mental health services, care, education and treatment reviews, CTERs, looking after children during coronavirus, getting reasonable adjustments from the health service, British Sign Language health access. Coronavirus is a new illness. Lots of people call it COVID-19 or CV-19. It can affect your lungs and your breathing. It is important that you stay at home as much as possible. But if you have a medical condition or injury which needs treatment, the NHS is still there to look after you. This summary is to help you understand how you can get NHS help when you need it. Personal protective equipment. If you do need to see the NHS workers, they might look different. They might be wearing personal protective equipment. This is when health workers wear extra protection, including a face mask, a face shield, gloves, and a gown. They wear this so they can work safely and help you stop coronavirus spreading to other people. Going to accident and emergency. If you are really ill or have hurt yourself, you might need to go to hospital. If you need to go to hospital, you should take your hospital passport and your coronavirus grab and go guide if you have one. This is a new kind of hospital passport which has been made to use during coronavirus. The grab and go guide isn't an easy read. So if you might need support, to fill it in. If it is an emergency, you need to call 999 and you might go to hospital in an ambulance or can go to hospital in a car or taxi. When you arrive at hospital, you will go to the accident and emergency department. This is usually gets called A&E. The people at the hospital will do some tests that will help them give you the right medicines or treatment if you need it. If you are hurting or scared, tell the doctor or the nurse who will try to help you. After your tests are done, you will be sent home if you are well enough. If you are not sure how you will get home, talk to someone at the hospital who will help it will help you. If you are not well enough to go home, you will be moved to a bed on a ward so that you can have treatment. Hospital appointments. If someone tells you that you need to go to the hospital, it is important that you still go. If you have any appointments already booked, you should still go to them unless you are told not to. If any of your hospital appointments have been cancelled, you will be contacted and told what you need to do next. Getting help from a GP. If you or someone you look after need medical help from a GP, something other than coronavirus, don't wait to contact them. The best way to do this is online or by phoning them. Don't go to your GP surgery unless you've been told by the GP staff. Someone will talk to you about your condition and will try to give you the advice and care you need. This could be over the phone or online. If staff at the GP surgery say you need to go to the surgery, they will tell you what you need to do to stay safe. Getting your medicine. If you or someone you look after usually take medicine, keep taking it not unless you are told not to. If you have a repeat prescription, you can order it by using your GP or pharmacy online service. Do not go to your GP practice or pharmacy to order prescriptions and only phone them if you cannot order online. If you need to go into the pharmacy, make sure you follow social distancing rules. Some pharmacies may be opening at different times than you are used to. Check your local pharmacy website for opening times or ring them up. Get, Getting help from the dentist. Because of coronavirus, dentists have stopped doing normal dental dental treatment. If you need urgent help from a dentist, you should call your normal dentist and ask them what you should do. Call NHS 111 if you cannot contact your dentist or you don't have one. If you need to see a dentist, you will be told what you have to do to stay safe. Getting help with eye care. Because of coronavirus, opticians have stopped using eye care services. If you have an eye care problem, you should phone your normal optician and ask them what you should do if you don't have a regular optician. You can find a list of all of them here. Call NHS 111 who will help you find the right help. If you need to see an optician, they will tell you how to do to do that in a safe way. If you have an eye care problem, you should not go to A&E and or the pharmacy or the GP surgery. Looking after your feelings with everything which is happening around coronavirus, we can sometimes feel worried and anxious. This is sometimes called your mental health. The NHS is here to support you, your mental health, and you can call our hotlines at any time of the day or night if you need urgent support. In this document, there is a few links that will help you find what you need. This and this link below is to find your local mental health helpline. Don't forget you can get somebody to help you to find the links. This guidance is about looking after your feelings and body. Specialist learning disability and autism and mental health services. If you use specialist services, you will still get support. If you use community services, the staff who support you may use the phone or internet to support you if they can't visit you right now. To stay in hospital, they will still send you home when you are well enough to leave. Care, education, and treatment reviews. ECTR is a meeting that makes sure you get the right care when you might need to go to specialist hospital or you are in a specialist hospital. ECETR is a meeting for children and young people. During coronavirus, we are changing the way CETRs are done until it is safe to do them in the usual way again. If you think you need a CETR, you should talk to your health or social care professional in charge of your care. Looking after children. If your child has a medical condition or injury, it is important that they get the right treatment when they need it. Remember, the NHS 111 GP and hospitals are still providing the same safe care that they have always done. If your child needs urgent help, go to your nearest A&E department or call 999. If you need to talk to a doctor or nurse today, you can ring your normal GP surgery or call NHS 111. Getting reasonable adjustments from the health service. The NHS has to make it as easy as possible for disabled people to use the health service as it is for people who are not disabled. This is called making a reasonable adjustment. At all NHS health services you should make reasonable adjustments. If you have a learning disability, you are autistic or both. This includes cancer, diabetes, mental health, maternity and heart services. Reasonable adjustments could be things like providing information in easy read, longer appointments if you need more time with the doctor or nurse to make sure you understand the information they give you, giving you priority appointments if you find it difficult waiting in your GP surgery or hospital, making changes to support you have sensory needs, letting you bring someone who supports you to on an appointment or letting someone stay with you in the hospital even if it isn't usually allowed or at the moment. Anything else that would make using the health service easier for you your you for you are allowed to ask for any reasonable adjustments to help you to be able to use the health service you need. British Sign Language Health Access. We all need to be able to talk to our doctors and nurses, and they need to be able to use this. Talk to us. This includes if you are deaf. You might need British Sign Language interpreter now because you can't ask family and friends to support you, or you can't lip read because someone is wearing a mask. Two organisations called Sign Health and Interpret Now have joined together to make a service called BSL Health Access. This lets you get BSL interpreters for free when you are communicating with health staff at any time of the day, even every day of the week. You can do this using the Interpret Now app on your phone or tablet. This is a step-by-step video that shows you how to sign up and download the Interpret Now app. To find out about the BSL Health Access, you can visit their website. The link is below. Remember, you can get somebody to help you with this.